Hello, Chris Juels. I'm a board-certified, fellowship-trained foot and ankle surgeon with the orthopedic department at Cookeville Regional Medical Center. It's been great getting to work with the orthopedic department here at Cookeville Regional Medical Center. There's a lot of unique things for the community that this group and faculty provide. Things such as having a total joint program where we have a nurse navigator that can help us as soon as we are deciding to plan a total ankle surgery. We have somebody that can guide that patient all the way through before the surgery to their final outcome and get things set up as far as physical therapy before and after surgery. Have a program where we have protocols in place to help with reducing narcotic use during their surgery, things about doing nerve blocks and different medications that avoid narcotics for the patient. It's been very unique and beneficial to have both hospital outpatient surgery and surgery center capabilities to be able to get these patients in and out in a timely fashion, which has also been fantastic to have for my practice and for the community. So over the last 10 to 15 years, there's been a lot of advances in total ankle replacement. We continuously update the polyethylene or the plastic piece that's in between the two metal components. There's a lot of science and textbooks behind there that talk about how there's intercross-linked polyethylene and it becomes ultra-high molecular weight polyethylene that helps reduce wear and tear and helps survivorship of the implant, so that it can stay in for a much longer period of time. There's also been significant advances in biomechanically putting the ankle replacement in anatomically. Before your surgery, you may get a CT scan beforehand, and from that CT scan, we can make a cut guide that's specifically made for the patient to help make sure when we make our cuts, we put the implant in the perfect position for that patient so that when they're starting to walk on it again, it's not wearing on one side or the other. There's also been advances as far as revision implants over the last 10, 15 years. We've started having implants where maybe they had an ankle replacement 10, 15 years ago, it's starting to wear out or subside or fail. Now we have options rather than having to take the whole implant out and the patient having a very difficult situation. We now have implants where we can just revise it to a bigger implant or one that has a stem in it. Or we can also replace the bone underneath of the implant, the talus, as a revision option as well. If you're a patient that has had an ankle injury in the past and now it's been 10, 15, 20 years later, and you're starting to have increased pain, swelling, stiffness, locking up, or maybe you're starting to get a little bit of deformity in your ankle, that could be a sign of you developing some post-traumatic ankle arthritis. And if that is the case and it's starting to affect your daily activity, there is a lot of different things that we can try to do to help you to get you back going and active in the community again. And there's various conservative treatments that we can provide, and we will try to do so for a long period of time. But if you're failing those conservative treatments, then you may be a good candidate for an ankle replacement.